Look at your feet right now, not in a mirror later, not tonight before bed. Right now, wherever you're sitting, take your shoes and socks off and actually look. I'll wait. Most people go years, sometimes decades, without really looking at their own feet. They're the part of the body we see least and think about least, tucked into shoes for most of our waking lives, the last stop before the ground. And that's exactly why I want to spend this video there, because your feet sit at the very end of a very long delivery route. And when something upstream in your heart, your liver, or your blood vessels starts to struggle, the feet are very often where the evidence shows up first. Think about it this way. Every drop of blood your heart pumps has to travel the entire distance down to your feet and all the way back before its next lap. That makes your feet, quite literally, the farthest, last stop on the delivery route your circulatory system runs over and over every single day. When the delivery system is working well, the last stop gets everything it needs, right on schedule. When something upstream slows down, whether it's the pump itself, the roads it travels on, or a warehouse further back in the chain, the last stop on the route is usually the first to notice the shortage, and often the last to get resupplied. That's your feet. And today I'm going to teach you how to actually read them, one feature at a time, the way I was trained to. If you want health explained in plain language, without drama, and without a sales pitch, subscribe and tap the like button. The goal for Dr. Riverson is 200,000 subscribers, and every person who joins moves that number closer. Let's go through this the way I would if you were sitting across from me. 5 things to check, in order, and 2 more I'll add at the end that go slightly beyond what you can see with your eyes alone. Start with color. In good circulation, the skin on the top of your foot and your toes should be a healthy pink-toned color, similar to your palm, regardless of your skin tone, and it should look roughly the same on both feet. A few specific colors tell very different stories. A bluish or purplish tint, particularly in the toes, can mean the tissue isn't receiving quite enough oxygen-rich blood, sometimes from a circulation problem, sometimes from a heart or lung issue that's reducing how well oxygen gets delivered in the first place. Skin that looks unusually pale or waxy, especially compared to the rest of your leg, can point toward reduced arterial blood flow, meaning the pipes carrying blood down to your foot have narrowed somewhere along the way, most often from a buildup of plaque, a condition called peripheral artery disease. And a yellowish tint, particularly if you also notice it in the whites of your eyes, is one of the classic signs of a struggling liver, because a failing liver can't clear a pigment called bilirubin the way a healthy one does, and that pigment starts showing up in your skin. There's a simple maneuver, one that vascular specialists have used for over a century, that can help you understand this more directly. It's called Buerger's test, named after the physician who first described it. Lie down and raise one leg up to roughly a 45-degree angle for about a minute. In a foot with healthy circulation, the color barely changes. In a foot with significantly reduced arterial flow, it can turn strikingly pale as gravity works against an already struggling blood supply. Then sit up and let that same leg hang down off the edge of a bed or chair. A foot with poor circulation will often flush a deep, dusky red as blood rushes back in, a reaction with its own name, dependent rubor. I want to be careful here. This is not a diagnostic test you perform on yourself to rule anything in or out. It's a demonstration of a real clinical sign. And if you try it and notice a dramatic color change, that's information to bring to a doctor not a home diagnosis to settle on your own. Next, temperature. Place the back of your hand against the top of each foot, one at a time, and compare them to each other, and then compare both to your calf just above the ankle. Feet that are consistently, noticeably colder than the rest of your leg, especially if one foot runs colder than the other, can be another sign of that same reduced arterial blood flow. Blood carries warmth as well as oxygen, so a foot that isn't receiving quite enough of it will often run cooler to the touch, sometimes long before you'd notice anything else. A single cold evening or cold feet in a chilly room means nothing. A persistent, one-sided temperature difference, day after day, regardless of the room, is worth paying attention to. Now, swelling. We've talked on this channel before about the ankle press test, so I'll be brief here, but it belongs in this scan for a reason, worth understanding specifically for the feet. When your heart's pumping ability weakens, particularly on the right side, or when your liver is struggling to produce enough of the protein that keeps fluid inside your blood vessels, that fluid leaks out and, thanks to gravity, tends to pool in the lowest point of your body available to it, which for most of us, most of the day, is the feet and ankles. If you press your thumb firmly into the top of your foot or the front of your shin, and it leaves a dent that slowly fills back in, that's fluid that shouldn't be there. And depending on the pattern, whether it's one foot or both, whether it comes and goes or persists, it can point back toward your heart, your liver, your kidneys, or your veins. There's an important distinction within that swelling sign, one that can help you understand which direction to look. Swelling in only one foot or ankle, especially if it came on somewhat suddenly, more often points toward a problem local to that leg, commonly the veins, including a blood clot or chronic venous insufficiency, where the one-way valves inside your leg veins that are supposed to push blood back up toward your heart start to fail, letting blood and fluid pool downward instead. Swelling in both feet, roughly equally, especially if it's gradual and worse by the end of the day, points more towards something systemic, working from the center outward, which is where the heart and liver come in. When the heart's pumping strength drops, blood backs up in the veins leading into it, and that backup eventually shows up as fluid pooling in the lowest points of the body it can reach, both feet at once. It's not a perfect rule, and plenty of exceptions exist, but 1 foot versus 2 feet is often the very first question a doctor asks when swelling is the presenting complaint, precisely because it points the workup in such a different direction. Then, look for hair. This is the sign almost nobody thinks to check, and it's one of the more reliable ones. Look at the tops of your toes and the lower part of your shins. Hair follicles are living tissue, and like any living tissue, they need a genuine blood supply to keep functioning. When circulation to the lower leg and foot declines meaningfully, often gradually, over years, the hair follicles in that area are among the first structures to lose the resources to keep producing hair. The result is skin on the lower shins, tops of the feet, and toes that's noticeably smoother and less hairy than it used to be, or less hairy than the skin further up the leg. This isn't about the natural variation in how hairy anyone's legs are to begin with. It's about a change, a region that used to have hair and gradually doesn't anymore. And it's one of the more specific signs of reduced blood flow that clinicians are trained to look for. Finally, the nails. If you've watched my video on what fingernails reveal about your health, some of this will sound familiar, but toenails tell a related, slightly different story, largely because they grow more slowly and sit even further from the heart. Toenails that have become noticeably thickened, discolored, or brittle over time especially without an obvious fungal infection, can reflect the same reduced circulation we've been discussing, because nail growth genuinely slows down when blood flow to the toe declines. Toenails that curve unusually, becoming rounded and bulbous at the tip in a pattern called clubbing, can reflect chronically low oxygen levels tied to certain heart and lung conditions. And nails that are growing unusually slowly overall, something you might only notice because you're trimming them far less often than you used to, deserve a mention to your doctor, particularly alongside any of the other signs we've covered. There are two more things I want to give you before we close this scan, because they matter enough to include, even though they go slightly beyond what you can see and feel from the outside. The first is a pulse check almost nobody's ever taught you, and it takes 10 seconds. On the top of your foot, roughly in line with the gap between your first and second toes, there's a pulse called the dorsalis pedis. Press 2 fingers gently there, not your thumb, since your thumb has its own pulse that can confuse you, and feel for a steady beat. Most people can find it with a little patience. A pulse that's difficult to find, noticeably weaker on one side, or absent altogether, is a meaningful sign of possible arterial narrowing, and it's precisely the kind of thing a vascular specialist checks in the first 30 seconds of an exam that most of us have simply never had. There's one more test worth adding here, and it specifically checks the nerves rather than the blood vessels, though the two often decline together. Close your eyes and have someone gently touch different spots on the sole of your foot, your heel, the ball of your foot, each of your toes, with something soft. The tip of a cotton ball or a tissue works fine. In healthy nerve function, you should feel each touch clearly and be able to say roughly where it landed without looking. Reduced or patchy sensation, especially if it's worse toward the toes and better as you move up toward the ankle, a pattern doctors call a stocking distribution, is a hallmark of peripheral neuropathy, most commonly caused by long-term high blood sugar. And this bonus is where those two checks, pulse and sensation, come together into a warning rather than just a sign to search for. It applies specifically if you have diabetes or blood sugar concerns. A cut, blister, or sore anywhere on the foot that isn't healing within a couple of weeks, especially if you can't quite feel it the way you'd expect a wound to hurt, is not something to wait out. Reduced circulation slows healing, and reduced nerve sensation, common with long-term high blood sugar, can hide a wound's severity from you entirely. This combination is exactly how minor injuries on the feet become serious medical problems in people with diabetes, and it's one of the very few situations on this channel where I'd tell you plainly, don't wait for the next scheduled appointment. Call and get it looked at. I want to give you a sense of scale here, because this is a genuinely common, genuinely underdiagnosed problem. A large primary care study published in the Journal of the American Medical Association, screening thousands of patients over 70 who came in for entirely unrelated reasons, found that roughly 1 in 5 had peripheral artery disease, detectable on simple testing, and the majority of those cases had never been previously diagnosed. These weren't people who'd ignored symptoms. In many cases, there simply hadn't been symptoms obvious enough to prompt a look, which is exactly the quiet pattern this whole scan is designed to catch earlier. Heart failure specifically deserves its own number here, because swelling is often its very first visible sign outside a hospital. Some estimates suggest that roughly 1 in 20 adults over 65 is living with some degree of heart failure, and because the earliest symptom is often nothing more dramatic than tighter shoes by evening, it's routinely mistaken for simply being on your feet too much that day. If you've watched my video on varicose veins, you already know about one-way valve failure in the legs on its own. What I want to add to that today is the other direction this same swelling can point, back up toward the heart, not just down toward the veins. Part of the reason so much of this goes unnoticed is structural. A standard annual physical for someone who isn't diabetic rarely includes a real look at the feet. It's not on the checklist. Podiatric and vascular exams tend to happen only after a problem is already loud enough to demand attention, rather than as a routine part of catching things early, which is exactly why I wanted to teach you how to do a version of this scan yourself. There's a broader pattern here I keep running into on this channel, across completely different parts of the body. The feet are simply too far from the center of a routine exam to get a real look, in the same way a kidney or a pancreas is too quiet to raise its own alarm. Nobody designed it this way on purpose. It's just what happens when a 7-minute appointment has to prioritize the loudest complaint in the room, and your feet, sitting quietly in your shoes, are rarely the loudest thing about you. Now, the honest part, because I don't want you finishing this video and diagnosing yourself with heart failure because your feet were a little cold on a January evening. Cold feet alone are extremely common and usually completely harmless, especially in people who simply run cold, in anyone in a chilly room, and often in women around and after menopause, when circulation to the extremities can shift for entirely benign hormonal reasons. Smoking, tight shoes, and simply sitting still for hours can all mimic pieces of what we've covered today, without any of it meaning heart or liver disease. The signal here was never meant to be any single feature on its own. It's the pattern, more than one of these signs showing up together, and especially any sign that's persistent and doesn't have an obvious explanation, that's worth a real conversation with your doctor. If something in this scan concerns you, the test to specifically ask about is called an ankle brachial index, a simple, painless comparison of blood pressure at your ankle and your arm that can directly measure how well blood is actually reaching your feet. I also want to be clear about who should be especially attentive to this scan. If you smoke or used to smoke, if you have diabetes or prediabetes, if you have high blood pressure or high cholesterol, or if you have a family history of heart disease, every sign we've covered today carries more weight in your case, and a proper vascular check is worth asking for directly rather than waiting for one of these signs to appear first. Everything I've shared today is meant to teach you how to look, not to diagnose what you find. It is not a substitute for a real examination by a doctor who can put any of these signs in the context of your full health history. Use this as a reason to actually look at your feet regularly and to bring anything persistent or unexplained to a real appointment, not as a verdict on your own health. If this taught you to see a part of your body you'd genuinely never looked at closely before, subscribe and hit the like button. That's how Dr. Riverson gets closer to 200,000 subscribers, and how this reaches someone else who's never once thought to check. Share it with someone you love, especially if they're diabetic or over 60, because a habit this simple, actually looking at your own feet, can catch something months or years before it would otherwise be found. Your feet have been carrying the evidence this whole time. Now you know how to read it.